जी मैम प्लीज आप स्टार्ट कर दें।
Okay, ये तो finish हो गई ना, because now I think start questions, because we have to see the causes and then treat accordingly the
मैम
which
आवाज
causes.
बहुत ज्यादा स्लो है।
eh, eh, 1 minute. We have to see that which is the cause, whether it is preventable, not preventable, treatable, not treatable in both male female. Then we will treat the infertility accordingly to reduce our social stigma plus as a economical burden on the couples. Hello? Hello?
जी आवाज क्लियर आ रही है सबको, बाकी सब लोगों को?
मैं तो आपको सुन पा रही हूँ, किसी और की आवाज मुझे नहीं आ रही है। हेलो? हेलो?
मैडम आप कंटिन्यू करें।
जी आयशा कंटिन्यू किया?
जी मैडम स्क्रीन शेयर थे तो कंटिन्यू करो।
अच्छा, वापस दोबारा?
ना मैडम जे स्लाइड ते छॾियो आहे न उतां हाँ।
हाँ हाँ ठीक है, भले थे। हाँ, female infertility can stem from structural, hormonal, or lifestyle-related causes. With today's advanced diagnostics and treatments, many challenges can be overcome, but we need early medical consultation boosts the chance of healthy pregnancy. It cannot be predicted or prevented until the couple start their sexual life. This is a disease which cannot be predicted. As we, for other things, other diseases, we take the vaccines, we take the preventive measures, or we can predict that but this cannot until and unless a couple doesn't start its sexual life. Thank you. It is a public health issue, but as I told you that to the extent it should be addressed, it is not. neither on the government level, not on the private level, because it is called an stigma. And we have the dearth of diagnostic facilities and treatment, which are very much expensive. And if one have the question that why it causes economic burden, we have no children, should not be worried about the economics. But because the diagnostic facilities, they are very much expensive and treatment. And to avoid this psychosocial issue and the mental health, one needs child. It is a human right. Rather, it is a human right to decide. So even equal and equitable access to fertility care remains a challenge in most countries. In especially low income and middle income countries like we live, it is very much rarely prioritized. It is not even prioritized in universal health coverage benefit packages. Although it is a part which we call as a family planning, it is a component of the family planning that the centers which are giving the uh, facilities of family planning, but our mindset is that it is only for contraception. One component is to address the whether fertility patient is fertile. It is they are supposed to address the fertility care also. But we don't know, our community especially doesn't know that whether they are for this purpose or not. Any question, please? महमूद को नहीं चावला है.
Assalamu alaikum. Hello.
जी जी वालेकुम सलाम. लिसनिंग.
Gigi, I would like to raise a few questions regarding fertility. Am I audible?
Yes. Yes. Yes.
It was a wonderful session and thoroughly, it's very much well explained and very precisely explained and covering all the aspects. And thank you so much, madam. I just want to have few questions since we are seeing patients on a daily basis. So, first of all, my first question is that I have seen a semen analysis report in which the morphological form of the sperm was not clear. It was the patient having a decreased morphologically healthy sperms. And the second was the rapid linear progression was also very much decreased, although that was a young patient. So, what are the options for such kind of patients?
There are some. First, we have to see what is the reason behind, whether it is due to infection, STDs, complete history. But if it is, I told prior, we need healthy infant, not only in quantity but quality, because a mobile 75%, 25% mobile with perfect morphology, but because it travels through the head. So depending upon the cause, whether it is what is the cause of it, it is treatable. Azoospermia cannot be treated perfectly, but if the morphology is not, then other is the IVF, but we don't have any facilities for that. We pick the uh, healthy sperm and can do it, but it is expensive.
प्लीज बाकी तो माइक ऑफ करें. ये नाइक मोहम्मद, आप माइक ऑफ करें प्लीज.
Okay, madam, thank you for the answer. I just wanted to know that when taking the thorough history, the patient was having taking steroids for the for the purpose of building muscles. He was a regular athlete.
Yeah.
And one positive factor which I've taken into consideration was he was a smoker, but he was a occasional smoker. He was not a chain smoker. Patient was very young, and both one he was 30 in his 30s, and his wife was also in his 30s. So when I have taken the thorough history, although I am not expert in this field, so I have referred him to the urologist. But these questions arise in my mind: that what does it mean if the rapid linear progression of the sperm is not good, or if the morphological form is less than 5%? So, is there any chance of conceiving in such kind of the people? So this was come in my mind at that time, and there was no answer. So today I just raised this question just to clear a little bit that is the only solution is IVF, or the couple can conceive if they have such problems and if they are in their mid-30s.
No, if it is only 5% morphologically, then it is very less quantity, because there are millions, 25 million per milliliter. Only one sperm we need to fertilize the ovum. But if the others are destroyed, so if there is morphologically they are not only 5%, the chances decrease very this. But IVF is very difficult, because it only 30% IVF are successful
Successful.
and very
Okay.
expensive. Only
Okay.
30%.
And madam,
70%
oh,
we can't know.
and it's
Yeah.
quite expensive nowadays. IVF is a very expensive treatment.
Yes.
Not everybody. Yes, madam. So, but the couple who wants to conceive and
Yeah.
having a child, if the only option left is IVF, so should they go for IVF or
It
should
is
they
more
wait?
mostly about 17 lakhs
Yes,
if
ma'am.
they have
Yes,
got the such amount. But when we refer the patients for this IVF, we tell them that there are 30%, and who they are doing these IVF procedures, they also don't clear cut say that you will 100% get the pregnancy. They
yes,
just
you are
fertilize
absolutely.
over, put it in an implant.
Yes.
6 weeks, they send us back. Then previously they used to put the patients up to 12 weeks. Nowadays, I have seen with my patient, they just fertilize, implant, and send at 6 weeks. And there are only 30% chances, because there are many risk factors. So it is little bit difficult.
Okay, madam. And second question I would like to ask is that nowadays it's very common for young girls to go to the gym or to perform activities just to having a good shape of their bodies, or just to be toned down and slim and fit. So does heavy exercise or heavy athletic activities affect female fertility? For example, if female is performing 7 days heavy exercise just to lose some weight, does it affect ovulation? Because I have studied that it will have a negative impact on the pituitary hypothalamus axis. So according to your knowledge, what you will comment about it, that is exercise is safe for females, especially if they got married and they are young, in their 30s or in their 20s, and or should they be cautious of exercises, especially in the early weeks of pregnancy when they try to conceive? Basically, I would like to ask that just having taking weights, having weight trainings or strength trainings in the gym, is it good for females who would want to conceive, or they should be very much subtle about their exercise, as it will negatively impact on their fertility?
Certainly it will negatively impact, because when they go for this heavy gym, heavy exercise, heavy dieting, crush dieting, it
Yes,
directly affects the estrogen progesterone of the female. We have seen that one condition, golden ovarian syndrome, which has anorexia nervosa. The girls used to do crash dieting, their ovaries become shrunken. This is or they get obesity, they go insulin, as the obesity, fat increases, the insulin increases, PCOS. Nowadays, we are seeing young girls with many menstrual disorders. And when this is my habit, that when they come, I get thorough history. First of all, healthy diet is very much, healthy exercise is good, but this crash which has been nowadays I'm observing, so I think in Pakistan only it is 22% infertility, 5 in 1 couples, while in other globally it is 17%, because we, without knowing the benefits and all these things, we follow the other people in Western countries without consultation of any professional healthcare provider. So it 100% affects our body metabolism and each and everything. And finally, they go in PCOS, they go into the this AMH is decreased, no ovulation. And nowadays, I think I am seeing more patient, and that is why we started to use these record videos for awareness of young girls, especially in rural areas, and especially of elite class, which want to make them very slim and all these things.
Thank you so much, madam. From your answer, I understand that exercise, if it's doing excessively, I'm not talking about crash diets. I'm talking about the excessive exercise. It will have a negative impact, and one should be moderate in their approach
Moderate.
towards exercise. And madam, you talk about AMH levels. So if a patient have all labs are normal and one level of AMH is about 1, so is it indicating that her reserve is less and she will be infertile in coming years?
No, every laboratory has got their own cutoff levels. One is, Khan has got the one is sufficient. But if there is ovulation issue, who can stimulate ovulation? After that, we have see, once this is fertilized, then we have to give other these medicines to carry on the pregnancy.
Okay, madam. Thank you so much. It was very informative, and thank you for your answers. Thank you. Thank you.
जी थैंक्स लॉट मैम। इंशाल्लाह मैं ग्रुप लिंक ओपन कर देती हूँ, ग्रुप ना प्राइवेसी का, ऑफिशियल ग्रुप का, तो वहां पे जिसका भी जो क्वेश्चन होगा तो वहां पे कर ले, ठीक है?
ओके।